Okay, imagine this scenario. You're a federal employee, maybe someone like Sarah who just talked about. You've got this nagging ache, maybe an old knee injury from years ago. Mostly fine, right? But then something happens at work. A slip, a twist, lifting something heavy, and suddenly, bam! That old ache isn't just an ache anymore. It's dramatically worse. So the big question is that still considered a work injury under FECA, the Federal Employees Compensation Act? It causes a lot of confusion, you know? But the answer, surprisingly often, is yes. A resounding yes, actually. Today we're doing a deep dive into exactly this, how FECA deals with pre-existing conditions, especially orthopedic ones, that get worse because of your federal job. Our mission, to kind of cut through all the jargon and complexity. We'll unpack the definitions, what does worsened really mean here. We'll look at the claims process, demystify it a bit. Talk about why medical evidence is just, well, absolutely crucial, what treatments are covered, and how getting specialized help can be a real game changer. Think of this as your shortcut, your guide to a really vital part of your rights as a federal worker. All right, let's jump right in. When FECA talks about a work-related injury, it's broader than you might think. It's not just new accidents. It specifically includes the worsening of conditions you already had.
Exactly. And what's really interesting, I think, is that OWCP, that's the Office of Workers' Compensation Programs, and the FECA rules, they actually identify 3 specific ways your job can interact with a pre-existing condition. It's either aggravation, acceleration, or precipitation.
Yeah, 3 different ways.
Right. And knowing the difference is key. Let's start with aggravation. That basically means a condition you already had gets worse because of something work-related, like an injury or maybe exposure to something at work. Now, here's a really critical distinction within aggravation. Is it temporary or permanent? This makes a huge difference for you.
Okay, temporary versus permanent aggravation. Got it.
So with a temporary aggravation, the work thing causes a short-term flare-up. Your condition gets worse for a bit, but then, maybe with some treatment, it goes back to how it was before the incident. Your baseline.
Right.
In that case, OWCP pays compensation medical bills, maybe some wage loss, but only for that period of aggravation. Once things settle back down to your baseline, OWCP's responsibility ends.
Ah, okay. So even if you can't do the old job because the underlying issue might flare up again, OWCP stops paying once the work-caused worsening stops.
Precisely. Their focus is strictly on the period the work made it worse. For Sarah, with her knee, if the fall just caused a temporary flare, OWCP covers that flare-up, but not, say, managing her underlying arthritis long-term once it's back to its usual level.
Okay, that's clear. What about permanent aggravation then?
Permanent aggravation is different. That means the work factors have materially changed your condition for the worse, and it's not going back to the way it was before. Like, maybe that fall caused permanent damage to Sarah's arthritic knee cartilage that wouldn't have happened otherwise.
I see.
If OWCP accepts your claim for permanent aggravation, then that condition is basically treated like any other direct work injury. There's no set time limit on the compensation or medical care related to that aggravated state. It's a much bigger deal long-term.
Huge difference. Okay, so that's aggravation. What were the other 2? Acceleration.
Right, acceleration. This is when your work duties speed up the natural progression of an underlying condition. So maybe you had a condition that would have gotten worse slowly over many years anyway, but your job duties, say, heavy lifting day after day, make it happen much, much faster.
Like it pushes the timeline forward.
Exactly. Think of someone with mild spinal degeneration. Years of physically demanding work might accelerate that process, causing significant problems much sooner than expected. If OWCP accepts an acceleration claim, it's treated just like a direct injury ongoing liability, no fixed end date.
Okay. And the third one was precipitation.
Precipitation, yeah. This is where work factors actually trigger a condition that was latent, meaning it was there but wasn't causing symptoms. It wouldn't have become active if not for the work exposure.
So like flipping a switch on a hidden condition?
Sort of. Imagine someone with dormant arthritis, completely unaware they have it. Then a really strenuous task, or maybe a specific incident at work, suddenly brings on the symptoms for the first time. In those cases, OWCP might accept the claim but limit it to the period the work actually made the condition manifest. Once that specific work-induced episode is over, coverage might cease.
Wow, okay. That's a lot of detail, but the main takeaway seems pretty clear. If your federal job aggravated, accelerated, or precipitated a pre-existing condition, FECA can cover it. You just need to show that work played a part, right?
That's the essence of it. Work has to be a contributing factor.
So now we understand what can be covered. Let's get practical. How do you actually file a claim in these situations? Does it matter how the worsening happened?
It absolutely matters. The how determines the which form you use. It's crucial.
Okay, so what are the options?
Well, if a single specific incident on a particular day caused the sudden worsening, like Sarah's twisting fall, you'd file a Form CA1 for traumatic injury.
CA1, traumatic. Got it. Like
Yeah.
an accident.
Exactly. And with a CA1, you should file it fast, ideally within 30 days. One potential advantage here is continuation of pay, or COP. You might get your regular pay for up to 45 days while you're off work.
Okay, that's helpful. But what if it wasn't one single event? What if it was gradual?
Good question. If the worsening happens slowly over time due to repetitive stress or your general work duties, think months or years of climbing, kneeling, walking, like in Sarah's case, if it wasn't the fall, then you use Form CA2 for occupational disease or illness.
CA2, occupational disease, so for gradual wear and tear.
Right. OWCP sees an occupational disease as something caused by your work environment over more than just one shift. Now, CA2 claims don't come with COP eligibility.
No COP for CA2.
Correct. But you can still claim compensation for lost wages using a different form, the CA7. Filing promptly is still important, usually within 3 years when you realized, hey, my job is making this condition worse.
Okay, CA1 for sudden events, CA2 for gradual worsening. Now, who actually decides if the claim is valid? Is it your boss? Your agency?
That's a common misconception. Your agency doesn't approve or deny the claim. They provide information, like about your job duties or the incident. The decision maker is OWCP. They're the ones who evaluate the evidence and make the call.
OWCP.
Right.
And you mentioned earlier, work doesn't have to be the only cause.
Correct. That's key. OWCP doesn't require work to be the sole cause. If your job duties contributed, even just in part, to the worsening, the claim could be accepted, even if, the natural progression of the condition or other life factors also played a role.
There's a catch, right?
There's always a catch, isn't there? The burden of proof is entirely on you, the employee. You have to establish that connection. And believe me, OWCP looks very closely at the medical evidence.
How closely?
Very. They need to clearly separate the effects of the work factors from the effects of the underlying condition itself. The Appeals Board, ECP, has said this many times. The doctor's report must have a rationalized medical opinion that differentiates between the work injury's effects and the pre-existing condition.
Differentiates. So explain exactly how the work made it worse beyond just normal progression.
Precisely. You need that clear medical link. And if OWCP accepts it as only a temporary aggravation, they'll say so explicitly, often even putting an end date on that temporary period in their decision.
Okay, this brings us squarely to the medical evidence. It sounds like this is where these claims really live or die. You said strong evidence is crucial, not just helpful, crucial. OWCP will deny claims that the medical reports are vague, right?
Absolutely. A vague report is almost useless. So what makes a report bulletproof for OWCP? It's about hitting specific points laid out in the regulations. Think of it like a checklist OWCP uses.
A checklist. Okay, what's on it?
Well, broadly speaking, it needs 3 core things: the full story, the objective science, and that definitive link we talked about.
Story, science, link.
Okay. First, the full story. Your doctor needs to include the dates they saw you, treated you, and importantly, the detailed history you gave them. That means exactly how the injury happened or the specific work tasks you believe caused the problem. This sets the whole context.
Makes sense? What about the science part?
The objective science. This is the hard evidence. Physical exam findings. What did the doctor actually see or feel? Diagnostic results, x-rays, MRIs showing changes. Measured loss of motion. Muscle spasms they observed. OWCP loves objective findings.
So just saying it hurts isn't enough.
Not nearly enough. You need proof. The report also must acknowledge your pre-existing condition. It can't ignore it. It needs the diagnosis, the treatment plan, all that standard stuff too.
Okay, story, objective science, and then the link. This sounds like the trickiest part.
It often is, the definitive link. This is the physician's opinion on causation, but it can't just be an opinion. It has to be a rationalized medical opinion.
Rationalized, meaning
Meaning the doctor has to explain why, based on medical principles, they believe the work incident or exposure worsened your condition. They need to connect the dots logically.
Can you give an example of that?
Sure. A good report needs a clear mechanism of injury. How did the work physiologically cause the worsening? Maybe the doctor explains that lifting and twisting increased pressure inside a spinal disc that already had some wear and tear, causing a new herniation. Just saying, my back hurt after lifting isn't enough without explaining the how. It also helps immensely to have objective before and after evidence if possible. Like maybe an MRI before the incident showed mild arthritis, but an MRI after shows a brand new tear or significant worsening right where the injury occurred. That comparison is powerful evidence for OWCP.
Before and after, that makes sense.
And finally, the core is the medical reasoning or rationale. The doctor needs to explicitly state why the worsening is due to work and not just the condition getting worse on its own or other factors. They might say something like, given the patient was functioning well before the incident and the MRI shows acute changes consistent with the trauma described, it's my opinion, to a reasonable degree of medical certainty that the work incident permanently aggravated the underlying arthritis.
Reasonable degree of medical certainty. That sounds like legal language almost.
It is, essentially. They need to use definitive language, not wishy-washy phrases. And again, clearly state what part of the problem is due to the work aggravation versus the baseline condition.
This sounds like it requires a doctor who really understands the OWCP system, not just medicine.
Yeah.
And it has to be an MD or DO, right? Or maybe a chiropractor for spinal issues.
Primarily MDs and DOs, yes. Chiropractors have a limited scope for FECA, mainly spinal subluxation confirmed by X-ray. Reports from PAs or nurse practitioners usually need a co-signature from a supervising physician to hold weight with OWCP. It definitely helps to have a physician experienced with these specific requirements.
Okay, so let's say you navigate all that. You file the right form, you get that bulletproof medical report, and OWCP accepts your claim for aggravation. What happens next? What benefits, what treatments are actually available?
Right. Once OWCP accepts the claim, you're generally entitled to the same range of medical benefits as someone with a direct work injury. FECA covers all medical care that is required to cure, give relief, or reduce the degree or period of disability from that work-related condition.
All medical care. Does that mean anything?
Well, anything reasonable and necessary for the accepted condition. And a huge point here. Under FECA, there's generally no fixed dollar limit or time limit on necessary medical treatment for the accepted condition.
No time or dollar limit. That's significant.
It is. So this typically covers things like doctor visits, specialists like orthopedists, physiatrists, diagnostic tests, x-rays, MRIs, CT scans, EMGs, medications, physical therapy, rehab.
What about bigger things? Surgery.
Yes, procedures and surgery too. Things like repairing a torn ligament, spinal surgery, even joint replacement, if the work injury significantly worsened pre-existing arthritis to the point it became necessary. Usually, major procedures need prior authorization from OWCP, but they are covered if medically justified for the work condition.
Okay. Assistive devices. Like braces.
Absolutely. Braces, crutches, 10NS units. FECA even covers damage to existing prosthetic devices if they were damaged in the work incident. And travel costs to get to your approved medical appointments are usually covered too.
It's quite comprehensive.
Yeah.
Are there any major limitations, though? You mentioned the temporary versus permanent thing earlier.
Exactly. That's the biggest limitation. OWCP only pays for treatment related to the accepted work-related aggravation. They will not pay for treating the underlying condition beyond the effects of that work aggravation.
So, back to the temporary aggravation example.
Right. If your claim is accepted only for a temporary aggravation, once OWCP determines that temporary period is over, that your condition is back to its pre-incident baseline, their responsibility for medical treatment stops. They won't pay for ongoing, say, arthritis management that you needed before and still need after the flare-up resolved.
Even if you still have the underlying condition.
Even then, they strictly cover the work-caused part. However, if the aggravation is accepted as permanent, or if it's an acceleration or precipitation claim that's accepted, then OWCP's responsibility is ongoing, just like for a direct injury. You could potentially receive lifelong medical treatment as needed for that condition.
That distinction is just massive.
It really is. And of course, OWCP won't pay for treatments they deem not medically necessary or unrelated to the accepted condition. They might request second opinions sometimes to verify treatment is needed because of the work injury, not just the natural course of the underlying disease.
And what about compensation if you have a permanent impairment?
Good point. If the aggravated condition results in a permanent impairment, say loss of range of motion in that knee, you might be eligible for a schedule award. That's a specific monetary award for the permanent loss of function of certain body parts. It's usually determined after you reach maximum medical improvement based on an evaluation using the AMA Guide's 6th edition.
Okay, wow. It's a lot. Complex definitions, specific forms, incredibly detailed medical proof needed, navigating temporary versus permanent. It sounds, frankly, overwhelming for an employee who's already hurt and trying to figure things out.
It absolutely can be. It's a bureaucratic system with very specific rules.
So is there help? Like, are there people or places that specialize in guiding federal employees through this specific maze?
Yes, definitely. That's where medical practices that focus specifically on federal workers' compensation cases come in. Places like, for example, Restore Muscle and Joint. They specialize in this niche.
How do they help, specifically? What makes them different?
Well, several things. First, they offer expert medical evaluations and that crucial OWCP-compliant documentation. Their doctors know exactly what OWCP needs to see. They'll do a thorough exam, review your past records to establish that baseline condition, use imaging to get objective proof of the worsening.
That objective proof we talked about.
Exactly. And they know how to write the narrative reports that explain the mechanism of injury, the causal link, and differentiate the work effects from the pre-existing condition, using that reasonable degree of medical certainty language OWCP looks for. They essentially build the medical case for you in the way OWCP understands.
So they handle the tricky medical documentation part. What else?
They provided administrative support, which is huge. They help fill out the forms correctly, the CA1, CA2, CA17 duty status reports, the CA20 physician's report. Some even help you write your statement for a CA2 claim. Critically, many have dedicated OWCP claims specialists on staff.
Claims specialists, not just doctors.
Right. These specialists can communicate directly with OWCP or your agency, make sure documents get submitted properly, help respond if OWCP asks for more info, or even assist with appealing a denial. They offer, free expert claims assistance alongside the medical care, which can prevent claims from getting lost in paperwork errors.
That sounds incredibly helpful, like having a navigator.
It really is. And of course, they provide the actual treatment and rehab, physical therapy, chiropractic, injections, pain management, coordinating surgical referrals if needed, making sure OWCP authorization is properly sought. They understand causation in this specific context and can help you articulate how your job duties led to the problem.
So they guide you on the whole process, rights, benefits, dealing with OWCP.
Yes, guiding you on rights like COP or wage loss, helping respond to OWCP letters, staying up to date on the rules and appeals decisions. They handle the OWCP billing correctly. And if you do end up with a permanent impairment, they can often perform the necessary AMA guides impairment ratings for a schedule award claim.
It sounds like having that kind of specialized team, one that gets both the medicine and the OWCP bureaucracy, is almost essential for navigating these aggravation claims successfully.
It can make a world of difference, honestly. It significantly increases the chances of getting your claim accepted and getting the treatment and benefits you're entitled to. It really simplifies a process that can feel incredibly complex and frustrating otherwise.
Okay, so we've covered a lot today. We've really taken a deep dive into how federal employees deal with workers' comp when a pre-existing condition gets worse because of work. We've looked at aggravation, acceleration, precipitation, those key distinctions. We've hammered home the absolute need for specific, rationalized medical evidence, explored the treatments OWCP covers, and importantly, the limitations. And we've seen how specialized help can be a lifeline. So here's something to maybe think about. The next time you hear about a workplace injury, or maybe, if you experience one yourself, remember, what you see, the immediate injury, might just be the tip of the iceberg. Often, the real complexity, the real medical and legal challenge lies in what was already there, kind of hidden beneath the surface. How does understanding that interplay, that connection between pre-existing conditions and work, maybe change how you think about responsibility, about recovery, and about what it takes to get fair compensation? Something to mull